Hi everyone, thank you so much for joining in. My name is Tara Hilton. I'm a Pediatric Nurse Practitioner and IBCLC, which stands for International Board Certified Lactation Consultant. And I'm here today to speak with you about any concerns you might have in regards to the topic of breastfeeding. Now, this is quite timely being that it is currently World Breastfeeding Week. World Breastfeeding Week takes place the first week of August. So I just wanted to wish everyone happy World Breastfeeding Week and thank you kindly for taking part in this video session. The intention was for this to be a live Facebook event. So for those of you who had logged on, I appreciate your efforts in wanting to participate. However, we did experience some technical difficulties that prevented us from moving forward with this being a live session. So I am recording this on video. The questions that may have come through during the time we were supposed to have the live session have been recorded, and I will be going through those questions today. Any questions that come up thereafter can certainly be funneled through our Facebook page as well as through our live chat option. So BabyLiveAdvice has a panel of providers. I myself am an IBCLC, so if moms have any questions about breastfeeding or would like to meet with me, we are able to arrange a consultation, and that would be through our telemedicine platform, so through a video chat. And you are able to book sessions directly through our app as well as through our website. We will be having on Thursdays Pacific time at 8:30 p.m. a different provider who will speak about various topics. So I encourage you all to mark your calendars, make it a weekly thing to take part in our sessions so that we can address any questions or concerns that come up about the healthcare, about the well-being, about breastfeeding, about any concerns that you have in regards to your baby or child, and pregnancy as well. So without further ado, I just wanted to chat with you briefly about what an IBCLC is and how an IBCLC can help. So an IBCLC typically has completed over 300 supervised hours of breastfeeding counseling to moms and babies. And they also have completed usually over 90 hours of lactation-specific education. They've successfully completed an exam that's offered through the IBLCE, and they have the credential that requires them to receive continuous education as well as to take the exam every 10 years to maintain competencies. The IBCLC credential is considered to be the gold standard when it comes to lactation support. So other providers can have the IBCLC credential in addition to their licensure or higher credentialing. So in regards to that, a nurse practitioner, a certified nurse midwife, a medical doctor, a DO, registered dietitian, a chiropractor, a registered nurse can also pursue their IBCLC credential. And then there's moms who had experiences of their own when it comes to breastfeeding. They wanted to give back to the women of their communities and decided to pursue the IBCLC credential. And with that, they would obtain hours in the community outside of being able to obtain those hours within their professional community. So a lot of times moms will be able to pursue this on their own. It might take a little bit longer just given the fact that their own experience with breastfeeding doesn't count as supervised hours. But we are seeing that we have higher rates of IBCLCs becoming available, and particularly in consideration of the breastfeeding-friendly hospitals, so hospitals that are equipped with lactation support, hospitals that promote the golden hour to maximize that bonding that takes place between mom and baby, that first hour after your baby's born. Looking at those 10 steps and fulfilling those requires the support of IBCLCs. So I'm delighted to see that there are more people accessing the profession, there's greater entry into the profession, and we are seeing even more so from a worldly perspective that there are IBCLCs that are becoming available all around the world in countries that previously didn't have any IBCLCs. So in consideration of World Breastfeeding Week and looking at our numbers here, countries that offer breastfeeding support to moms through extended maternity leave, looking at the duration of breastfeeding as well as exclusivity, it allows us to capture areas that could certainly benefit from additional support or additional donor funding so that we can maximize our breastfeeding support potential and to increase our breastfeeding rates. So just a couple of fun facts in regards to World Breastfeeding Week. Who started World Breastfeeding Week? It was actually started in 1992, so 26 years ago, by the World Alliance of Breastfeeding Action. And now it has become more of a partnership with UNICEF and is a global breastfeeding collective, which means that we look at data from all different countries to see where we measure in terms of our ability for moms to receive that breastfeeding support and to increase our rates. So a couple of fun facts about the United States. About 20 to 40% of babies are exclusively breastfed between the ages of 0 and 5 months. Now at 6 months, that's when we introduce solids. So our goal is for exclusivity of breastfeeding up until age 6 months and to continue breastfeeding up until at least 1 year, 2 years preferred. The World Health Organization does recommend that moms breastfeed 2 years and beyond. The American Academy of Pediatrics recommends that moms breastfeed 1 year and beyond. And we do see that the babies greatly benefit from being able to have been breastfed for 2 years plus. So in consideration of those recommendations and looking at our numbers and where we stand in the U.S., at age 1 year, less than 40% of moms have continued breastfeeding in the U.S. And up to age 2 years, it's less than 20%. So our numbers are a bit lower compared to other countries. However, moms do go back to work full-time, and in regards to our maternity leave, we do have less maternity leave than a lot of those countries that have longer breastfeeding continuation rates, such as the Scandinavian countries, which have a little over a year of maternity leave. So these are just stats that came up more recently in the Global Breastfeeding Collective, so I just wanted to share those with you. But moving forward into our topic here, providing breastfeeding support, I did want to go through some of your questions. It'll be more of a Q&A session. So some of the questions that were collected at the time that we were supposed to have our Go Live event, I am able to answer now. So one of the questions that came through was, how do I know my baby is getting enough? And this is a very common question that moms have. So how do I know that I'm able to produce enough milk? How do I know that my baby's satisfied? How do I know that my baby's gaining weight? So oftentimes moms consider having a lactation consultant involved with their baby's care and to provide support when they've gone to the pediatrician and they're told, baby's really not gaining so well. Do you want to consider formula supplementation? And moms say, oh, no, is there anything that we can do prior to supplementing with formula? If the weight is just not where we want it to be, do I have some wiggle room to be able to address some other issues that might be happening that could allow for me to produce more milk so my baby can gain weight adequately? And of course, you want to follow the advice of your pediatrician in regards to what we need to do to increase that weight. But we do want to also look at, well, what could be happening with my breast and how can I maximize my breastfeeding potential? So for babies who are not gaining as well as we would like, and the pediatrician wants you to speak to a lactation consultant, this isn't severe weight loss where we need a higher level of intervention, but we want to keep a close eye and we want to get things on track and to be able to produce as much milk as we can to satisfy the needs for your baby. And IBCLC can certainly assist with that. So what we're looking for is making sure that mom is maximizing her breastfeeding potential. So what I mean by that is on-demand feeds and ensuring that our supply meets our demand. So anytime we introduce a bottle, anytime we introduce a pacifier, that's one less opportunity for your baby to go onto your breast to stimulate your milk supply so that you make enough milk for them. So oftentimes moms don't realize that, and especially in the early newborn period, it's so important for you to be stimulated often so that you're making enough milk for your baby. And by often, I mean on demand as your baby dictates. So at the very beginning, the baby really runs the show in terms of how often they're going on the breast. We want to make sure that we're maximizing their time at the breast so they're getting the most milk that they possibly can and that they're satisfied. So when a baby goes onto the breast, that sucking causes a stimulation in your milk hormones so that you can produce milk. So every time that baby's warm, moist mouth makes contact with your nipple, you receive a surge in your hormones so that you can produce milk. And if the baby was to just sit there sucking, you'd experience that surge initially, but then you would actually start to plateau. So it's every time that the baby makes contact with the nipple that you have that surge in your hormone to help you make more milk. So that's why babies often in the early newborn period are going on so frequently, because they're just beefing up your milk supply and causing those little pulses or surges to take place so that you can have an adequate milk supply moving forward. It's all in that preparation and establishing that hormonal orchestration so you can have an adequate milk supply. So what we look at is, are we being stimulated enough? Have we given the baby any pacifiers? Have we decided to give some bottle feedings? At that time, if we were choosing to bottle feed, we want to make sure that we're stimulating our breast so that we can produce enough milk. And an IBCLC can closely follow your baby's weight trends. So looking at pre and post feed weights, there's other ways to assess for breastfeeding adequacy, looking at how many wet and dirty diapers your baby has in a day, looking at the color and consistency of the stool, looking at your baby's skin color as well, looking at how your baby latches onto the breast, and observing that latch to ensure that this is a good latch, that this baby is getting the maximum amount of milk in that period of time that they are at your breast. So aside from that, we also want to look at the baby's temperament and the baby's mood. So does your baby appear satisfied after feedings? Does your baby still appear frantic and hungry and rooting? The rooting reflex is when they're opening their mouth and they're moving their head side to side. They're not necessarily shaking their head no, although sometimes it looks that way, but they're opening their mouth and they're looking for a breast. Another thing that we see babies do is they try to reach up for the breast, and they'll oftentimes have their hands in a fist, and by reaching up, they're actually trying to stimulate mom to have a letdown for them so that they can receive that milk. So oftentimes moms think of that as, well, is she trying to fight me off or punch me? But no, she's actually trying to get that milk to come down to her. The fists tell us a lot. When babies have their hands in a fist, it often means that they're hungry, because one of their instincts as a mammal is to have that milk come down. So they'll use their knuckles to knead into mom's breast to encourage that milk letdown. When their hands are open, that usually indicates that they're more satisfied. And when they kind of go halfway, open, close, they're just getting there. So if we're questioning after your baby has fed, if they've received enough milk, take a look at their hands, because oftentimes if they're still in a fist, it might just mean that your baby got very cozy with you. They listen to your heart rate. They know that they're with their mom. They take a couple of sucks. Their belly feels better. Now they're a little bit more satisfied. But then once they start to settle and get cozy, they stop sucking. They haven't had a full feeding. They may have just had a snack. Looking at their fist, we can determine, do I need to wake her up a little bit more? Do I have to make her less cozy? Sometimes moms, they'll remove the baby, pass the baby on to a relative. Baby wakes up, wait, oops, I'm not done yet. Put me back on, and then they can continue with that feed. So making sure that we're aware of different positions that the baby can assume, aware of different cues, that'll help us to predict how we need to respond to our baby in order to maximize our breastfeeding potential. Looking at our next question, what foods can increase my milk supply? So that's a common one as well. And the foods that can increase milk supply are oatmeal. Fenugreek is one, and that's available as a tea or a capsule. Apricots, brewer's yeast, as well as spinach and garlic are foods that can contribute to increasing mom's milk supply. Now, if a mom has a milk supply that's in question that isn't responsive to the stimulation piece, that isn't responsive to some of the dietary recommendations, then there are other herbals that we could recommend. There's some teas that we can recommend. And then ultimately, if we need to, there are some medications that mom can be prescribed by her midwife, by her OB, or a pediatrician who feels comfortable working in breastfeeding medicine so that mom can have that increase in her supply as needed. Another question is, what age should I breastfeed until? So this is a common question, and I want to be worldly in consideration of it being World Breastfeeding Week. So the answer is, in America, the American Academy of Pediatrics recommends that babies breastfeed exclusively for the first 6 months of life. The World Health Organization also recommends babies breastfeed exclusively for the first 6 months. At 6 months is when we typically introduce solids. So anything else that goes into a baby's mouth would affect that exclusivity definition. So what I mean by that is pacifiers, solid foods, bottles. So if we introduce anything else, that throws the exclusivity piece out the window. Because truly, by definition, breastfeeding exclusivity is only making contact with mom's breast. So both World Health Organization and AAP recommend the first 6 months. World Health Organization recommends 2 years and beyond, and the American Academy of Pediatrics recommends 1 year and beyond. Now, just looking at some interesting stats, the World Health Organization and UNICEF has reported their Global Breastfeeding Collective, and what they've looked at is the continuation of breastfeeding and the percentage of moms in the United States who are breastfeeding past that 0 to 5 month mark. So what they've captured is from 0 to 5 months, about 20 to 40% of babies in the United States are exclusively breastfed. Less than 40% are continuing breastfeeding after age 1 year, and less than 20% are continuing breastfeeding after age 2 years. So in comparison to other countries, we can certainly do a better job of that. And that is the most recent statistic that's come out in the Global Breastfeeding Collective. So in regards to the other questions that have come my way, I had a mom who had asked about what positions that she can put her baby in to help with her pain following a C-section when it comes to breastfeeding. So typically with the breastfeeding positions, you have your cradle position, cross cradle, your football hold, side lying. You can have your baby laying on top of you, which is especially useful for moms who may be experiencing oversupply. But for moms who had a cesarean, typically they have pain that when we have a baby who's breastfeeding about 6 to 8 hours a day, when you have a baby that you're holding, that can elicit some pain because of the pressure of that infant on your incision or close to your incision. So we do often recommend that moms hold the baby in a football hold, which looks like you're holding a football, and you position the baby so that your forearm is supporting that baby along the side of your torso so that you don't have any pressure on that incision. I had a question come through: how many calories in a day do I need to consume while I'm lactating? Now that's a great question, because oftentimes moms, after they have a baby, they want to go back to losing weight and they want to get back into a gym regimen once time allows, right? So in consideration of your ability to produce breast milk, you need to increase your calories in order to meet your demands. So you burn about 500 calories a day breastfeeding. That's about 20 calories per ounce. The interesting thing is, breastfeeding, what we estimate is that 1 ounce of breast milk has about 20 calories in it for babies that we give to them. So every time you pump one of those ounces of breast milk, it's lowering or burning off 20 calories in yourself as a mom. So in terms of the calories that we need additionally, we recommend a bare minimum 1,800 to about 2,500 calories per day while you're lactating. So typically it's about 500 calories over what you were consuming prior to. So 1,800 is the minimum. But if you were consuming a diet of 2,000 calories prior to, then you should be at the 2,500 mark. So about 18 to 2,500. I prefer to recommend 22 to 2,500 so that we are over. 1,800 is on the bare minimum side. And then foods that we can consume. Really, moms can eat anything. Now, you might find that certain foods may trigger a response in your baby more so than others, but you want to have a well-rounded, healthy diet overall. You want to have a diet that is high in fats. You want to make sure that you're drinking enough fluids. Always have a water bottle with you because really you're still like a hormone factory when you're lactating. So a lot of times moms complain of thirst or excessive thirst and just feeling flushed or hot, especially as your hormones in the early newborn period are trying to regulate. So in order to support that, you want to make sure that you always have a water bottle close by, and that will also help with your milk supply as well, maintaining hydration. Aside from that, I had a question that came through in regards to Lamaze. So I am also a Lamaze childbirth educator, and the question that came through is, tell me about Lamaze, and is it all about the breathing? Now, Lamaze was created in the 1950s, and back then it was considered to be a form of birthing support that involved breathing techniques to encourage relaxation to help moms who had opted for all-natural childbirth. Since then, Lamaze has certainly evolved in its approach. So what we do is we empower moms and equip them with the education so that they can make informed decisions. So moms who are interested in all-natural childbirth or moms who are interested in pain management options, providing them with the education needed as well as understanding more of the physiology of their own hormones so that they're aware of how the body normally responds to birthing and how these hormones can help us with the pain management piece and what that expectation is. So we do go over breathing techniques as well, but we have certainly evolved from when Lamaze first came around back in the 1950s and what we were offering at that time, where it's more of an informed decision and preparation, and that we normalize childbirth and the ability for a woman to be empowered and to be able to birth a child normally and naturally. I also have a question in regards to a tongue tie. So the pediatrician tells me my baby is not tongue-tied, but my lactation consultant thinks she is. Who should I trust? So oftentimes I get the question in regards to moms who are having any issues with their baby's latching. It could be related to a chomping, or moms present with extensive nipple trauma, or moms feel that the baby just isn't transferring enough, or moms might have an oversupply, which is her compensatory mechanism for a baby who is tongue-tied a lot of times, where the baby doesn't have a deep enough latch. They're kind of just hanging on the tip of that nipple. Our bodies are very amazing. Mom's body will compensate and produce an abundance of milk so that that baby can really just hang out with the breast with their mouth open, and milk will just shoot into it. Or the baby is just not stimulating mom enough because they're not latching and being able to provide that stimulation that's needed for milk supply. It can go one way or the other. So tongue tie can have unique presentations, but what we do see a lot of times is that breastfeeding isn't going so great. Doesn't mean that if breastfeeding isn't going so great that it's a tongue tie. Absolutely not. But the common denominator is breastfeeding isn't going so great. Mom may have pain as well. Baby may be gaining too much or gaining too little, or gaining normally. But what we look for is doing an oral assessment of the baby's oral anatomy and to see if there's any sort of tethered cord that could affect the baby's ability to latch on deeply and effectively, and to be able to use their tongue in a way that will maximize breastfeeding and will be able to stimulate mom and create a supply that's specific for what that baby needs. So in terms of who do I trust one versus the other, you want to hear the input from both providers. So what your pediatrician is advising, what your lactation consultant is advising, and Ultimately, you want to make sure that if you are concerned and suspicious, and I always say you have to follow your mama heart. If you feel that something isn't right and it's not consistent with advice that you're receiving, you have to follow your mama heart and to receive the advice from someone who's well vetted and experienced in that area that we're questioning. So, of course, you can always consult with one of us here at Baby Advice Live. And you can also reach out to providers who are known to be specialists in that area. So when it comes to tongue-tie support, the IATP, which is the International Association of Tongue-Tie Professionals, so looking at those who are educated extensively in assessing child for tongue-tie, the treatment options that may be available. You certainly want to touch base and to schedule a consultation with someone of that specialty. And aside from that, my pediatrician wants to start my baby on vitamin D. How much should I give, and can I take extra vitamin D so that I don't have to give this to my baby? So vitamin D, is also known as the sunshine drop or the sunshine vitamin, is one that we also receive from the sun. But in consideration of us wearing sun protection and not having exposure, direct exposure to the sun, at least an hour a day, in order to be able to synthesize greater vitamin D, has led to vitamin D deficiency. And a lot of moms do experience vitamin D deficiency, especially in areas where the sun doesn't shine too much. But in consideration of your baby, the reason why it's so important for a baby to be able to have vitamin D, which there is a small amount of vitamin D in breast milk, is to prevent something called rickets and to promote the healthy development of the baby's bones. So we do recommend starting vitamin D very early. So in order for a breastfed baby or a formula-fed baby to receive adequate vitamin D, you can either supplement, which would be 400 international units that's given once a day, every day, or the baby, we have the ability to fortify formula with anything that we desire, right? So we are able to put vitamin D in the formula, but in order for an infant to consume adequate numbers of vitamin D solely through formula, they need to consume about 1 liter a day, which a newborn is not doing. So ultimately, all babies should be supplemented with vitamin D until the formula-fed babies, if they are consuming 1 liter or more, then they can just consume and receive adequate vitamin D from formula. Breastfed babies, they do receive some vitamin D, like I said, but we do recommend, the American Academy of Pediatrics does recommend that we provide babies with 400 international units of vitamin D, especially the exclusively breastfed babies. But my recommendation and consideration of how much they can get from formula is that all babies should be supplemented until we know that they're taking at least 1 liter of that formula. And it's certainly not something that we would say babies should receive the vitamin D from formula. Absolutely not, and I want to be clear on that. It's more or less that we have the ability to put vitamin D in formula, so moms who have made the decision to formula feed their babies can acquire it that way as long as they're taking 1 liter or more. For the breastfed babies, it would be either a preparation that's known as the sunshine drop, which is a little droplet that mom could actually place just right on her finger or on her breast and allow the baby to latch and they receive the vitamin D that way. Or it's one that could also be found in a baby's multivitamin, which includes 400 international units of vitamin D, which is also known as Trivisol. And both of these preparations are available over the counter, and it is something I encourage you to discuss with your pediatrician at the time of your baby's first wellness visit. And aside from that, I think that is it when it comes to our questions for this evening. I just wanted to say that in regards to support and the importance of having support following your hospitalization or following your home birth. I can't emphasize enough having the access to professionals who can provide you with answers to your questions, who can assess a latch and can give you the reassurance and some tips and pointers on how we can reduce pain at the breast or how we can maximize our baby's time at the breast and ways that we can promote bonding as well as increased milk supply. I can't emphasize enough having a plan in place for someone who can assist you in the outpatient setting, meaning once you're discharged home. Certified nurse midwives oftentimes include lactation support sessions, so they're visiting those moms more frequently for their postpartum checks, so they have plugged-in lactation support, or they often at times have an IBCLC on staff who can provide that support. At BabyAdvice Live, we're available to have a video conference for moms who are struggling. You can set up an appointment with one of us, or we're able to answer your questions through the live chat option, as well as you can funnel your questions through. On Thursdays, we are available Pacific time from 8:30 to 9, and you can also post your questions on Facebook. So anybody who has questions in regards to my session or has questions about breastfeeding in general, please funnel these questions through to our Facebook page. I'm happy to reach out and to answer any questions that you may have. And we can also, if you have an interest in going in any further, we can arrange a one-on-one consultation through our telemedicine platform, which is available through our app as well as through our website. I want to thank you for taking the time to view this video, and I hope that you found this content helpful, as well as want to commend you for your commitment to breastfeeding and for being so supportive. Thank you all again, and happy World Breastfeeding Week. Enjoy your time, and I hope you will have a wonderful weekend. Thank you very much.